Welcome, dear viewers, to our format today, Natural Medicine. Today I'm talking to our chief physician, Alexandra Kotthaus, about the topic of the gastrointestinal disaster, how we keep our bodies in an imbalance with constipation and diarrhea, and how this also has consequences for the whole of health. You'll find out now. Stay tuned. Hello, dear Alexandra.
Hello, Karina.
Nice to have you here.
Thank you very much.
This topic of the intestine, I don't know, it's been with us for so many years now, where some have constipation, others have diarrhea, the third has a stomachache, take something again, then you have parasites, then the fungus. So it's really a disaster, isn't it? A gastrointestinal disaster.
Yes, if you put it that way, I can only say yes.
And then there's antibiotics.
Yes.
This intestine, which should actually be in balance.
Yes. Antibiotics. I like to say our Western, so-called civilized way of life is a bit of a frontal attack on our intestine and our microbiome.
It's nice that you also called it antibiotics, so that we know right away that it's against life.
There's a saying, death sits in the intestine. I think, I don't feel like this negative anymore. Life too.
Yes. And life really linked to positive intestinal bacteria that work for us. How can I find out what's going on in the intestine? If the intestine really affects the psyche.
Where do I start?
Is it the stool analysis?
I know what you mean. It's like this, I ask. And then the patient says, I ask, how is it with the intestine? Is it daily at all? How often is it daily? Is it always shaped? Is it sometimes more like a ball? So rather hard. And is it more diarrhea? Is it muddy? And is it yellow? And do you feel a pinch before? Do you have cramps? Does it itch a lot in the stomach? The fewest say, no, everything is totally great. I went to the toilet 1, 2, 3 times a day. It's always shaped. And then the question arises, do we do a stool analysis? I'm a little reserved. You can pay 300 here in Switzerland. The laboratory has now changed. Made as the suggestion to pay 450 francs for it. But I say, seriously, do you think we won't find anything in the analysis? It's clear that there's something wrong with the intestine. And then it's clear that I have to help the intestinal bacteria. That I have to get the garbage out. That I calm the intestinal mucosa. And so on. And then I do. But if you want to, we can do that. My suggestion is, we start with therapy. And if it's not good, you can still do it.
Can you, based on the different stool qualities, refer to any dysfunctions or imbalances? If you just called it soft, bubbly, or yellow.
So yellow, of course, is gallbladder. The brighter and discolored it is, the worse the gallbladder acids are excreted. For example. But it's also a bit of an oracle. Of course, the stool should come out without any problems as regularly as possible. Probably at least once, maybe even 2 or 3 times a day. Rather even the more frequent, in an appropriate amount, the healthier. But we don't have a natural environment. So how can we scientifically find out what a healthy stool is? We can. These are guessing games, in principle, what we're doing there. But let's put it this way. At least the experience shows that someone who goes to the bathroom twice a day, let's say, if using toilet paper is right or wrong. But most people who don't need toilet paper tend to find it extremely pleasant. It's just not like they have a stool every day, but they have the feeling that it is a pleasant and complete emptying. Often a good stool doesn't get stuck with traces in the toilet. I think my part of it is, let's say, we didn't have toilet paper 60,000 years ago. But we also have it ergonomically.
Ergonomically, we're sitting in a completely different way.
We're not made to sit on a toilet bowl, but to sit. Then I have a different angle, a different opening from the rectum, and it can come out more easily. And if we were to use the toilet now, you could squat down so that the legs are simply angled. That's true, but let's put it this way. The body can still regulate that if there's not too much chaos in the chair. How do I regulate that? The easiest way, of course, is with nutrition. I feed the gut bacteria, the right ones with the right nutrition, and the wrong ones with the wrong nutrition. That's a bit simplified, but I can do a lot with it. I can also reduce inflammation in the gut with certain foods, relieve deposits in the gut, soothe the mucous membranes. Like oatmeal.
Yes, exactly. Give me a few examples.
Oatmeal cooked with water, please.
But do I really pay attention to the oats, which is really super biodemeter, that I don't have the glyphosate, which again are problematic?
These also kill our gut bacteria. That's right. The plants that are sprayed try to neutralize this poison in themselves. As a result, they also have fewer secondary plant substances that we no longer have available for our immune system, for example, or as antioxidants. And then they continue to work in our gut and then also kill our gut bacteria. So, of course, there are a lot of things that you can do with oats. So oatmeal. Relatively well known also is the Moro soup, named after a pediatrician called Moho, who discovered it in a children's home at the beginning of the 20th century. If the children have diarrhea, then he put it in a long stretched soup with very simple ingredients. The recipe is simply on the internet, Moro, M-O-R-O. He cooked this carrot soup. It's a coincidence that has called Moro and it's a carrot soup. And he found that it helps incredibly well against diarrhea, even with acute infectious diarrhea. Depending on what the cause is or how much diarrhea, or how thin it is from time to time, I can also achieve a lot with a green smoothie, because chlorophyll also binds toxins. I can also cut in fresh aloe vera leaves in a green smoothie, i.e. only the gel inside, and put it in there. I can also use pineapple and papaya in a smoothie to support the intestinal and digestive functions. Certain things can also be left out, which in turn stimulate the intestine, promote inflammation, or are simply real intolerances. Of course, this also plays a role. And last but not least, it's also important to me to say that we sometimes see the intestine as a pipe. I fill something in at the top, then it has an effect in there, and then it comes out again. I once did a show about the intestine with Alexandra. Much more than just intestines. It was so important to me to say that the intestine is not alone in the stomach. There are a lot of other things to do with it. The intestine can also go crazy when I have viruses in the lymph nodes in the intestinal membrane, or in the lymphatic system, when the liver doesn't work properly. As long as I detoxify, if my gallbladder is not properly put together, which is produced by the liver, which is released into the intestine, then it can also lead to bloating during detoxification. It's not always that you have an intolerance. There's a little sound in every bean, and an onion, too. Can we do a little bit of farting? That's okay. Farts that are healthy, it's just a rough rule of thumb, they usually don't stink. Or they are often not extreme. Or, oh, it's really bad and uncomfortable. There comes out a little bit. But that's not always. Oh, I have an intolerance. I couldn't tolerate it, by the way. If you are farting, it could also be what you ate the day before, that you can't stand that. It's not always the last meal.
Yes, but I also always ask, if the farts really always stink, smell, then you can assume that the thing inside is just rotten, right?
That's not unlikely. That's true.
So that you don't ignore it.
No. That's an interesting point that you mention, because we also come to the question of intestinal mobility. How fast does the intestine move? It's not just the composition of the food or the microbiome, but is the intestine able to transport the food to the outside in an appropriate time? A. Does it have to do with the nervous system? It's the serotonin. It's maybe the magnesium. If I can get the food out quickly in an appropriate way, then of course it doesn't germinate or less, even if I have a few wrong bacteria in there. It's actually the case that some people have several kilograms of stool in their intestines, even if they have a stool formed once a day, every day, and feel that it's an appropriate amount. Many people tell me that if we change the diet, that it's usually more balanced or fresher than before, that they or certain people also feel that they have a lot more stool than before.
Bei bestimmten Entgiftungssubstanzen empfindet man das auch eher so, dass sagen, ich habe viel mehr Stuhl als früher.
It's probably a mix between the detoxification and the final release.
Und es kommt endlich raus.
You notice it in a colon hydro, don't you?
You notice it in a colon hydrotherapy, and I've seen enough x-rays with strange complaints, stomach aches, cramping stomach aches, where you've seen an incredible amount of stool in the intestine. I also had a child who told me that she could go to the bathroom every day, and she was still full of stool.
Die kann jeden Tag zur Toilette gehen und die war trotzdem voll von Stuhl.
Does it make sense to take a piece of share plum or something like that and say, I'll go to the bathroom in the evening when I know I'll be at home the remaining day?
Before it's in the intestine, yes. I had this question yesterday with the share plum. Then, yes. I have relatively few patients who still have problems after 4 weeks. There are patients, if we're talking about diarrhea and constipation, you have to make it very clear that it belongs to be asked in detail. In the worst case, you have to have a worst case taught and also exclude the cancer before you blindly treat it. As a medical student, as a doctor, alternating diarrhea and constipation, that's cancer. That's how you get taught. I don't want to let that fall under the table. But often the patients already have an odyssey behind them, with trials, with doctor's visits, with colonoscopy, with intestinal and gastrointestinal examinations, so that the clarification is actually done, and then I can do it. I have to say, I don't have that many patients who still have problems after 4 weeks. If I just do a little something for the intestines, calm the mucous membranes, work a little anti-inflammatory, change the diet.
What else is there? We had chlorophyll, then we had oatmeal. What else nourishes the good bacteria?
Chlorophyll. Chlorophyll is my favorite molecule. I find it incredibly important. Chlorophyll, the leaf green, is found in greens. With it I can feed the bacteria, the good ones, wonderfully and bind toxins at the same time. We have a special preparation with us in Sonnenberg, Dr. Rao's Neurosana, which also calms the intestinal mucous membranes. It contains plant extracts, such as moringa and turmeric, which gives many people very fast, very pleasant gut feelings. It contains a little quercetin, acetate extract, very sensitive. I have a younger child. I don't like that so much. But it works very fantastically for the intestines. I have already beaten so many flies with one flap. Great.
And with what? What can I eat so that I don't feed the bad ones?
The bacteria are exactly starved by not getting their favorite food. Their favorite foods are things with bad fats, sugar, dough products, milk products. They do that too. Yes, of course. It is extremely common to leave out milk products. On the one hand, there are more milk products. On the other hand, there is more gluten. Milk intolerance is extremely common. Milk intolerance. I don't mean lactose intolerance. It is extremely common, but also the reaction to milk protein.
You also notice when I'm totally vegan or fasting, you can't eat cow's milk products because you get such a gamey taste in your mouth.
Man kann schier keine Kuhmilchprodukte essen, weil man so einen gammeligen Geschmack im Mund bekommt.
You also become more sensitive to what is good for you, what is not good for you. What do you think about sauerkraut, fermented things?
I'm not really a fan of that.
That's why I'm asking you, because you always have your own opinion. I thought you definitely have a new opinion.
Yes, yes. If I can't go to the toilet and eat a portion of sauerkraut, it always works. I'm not so sure that it works, because it seems to be regulating, because it seems to be really laxative, because the body doesn't like it that much. Fermentation used to secure survival for people when there were no refrigerators. But when I eat fresh things, it certainly makes more sense than to eat fermented things. In a way, it's a slow-down process. Of course, not only bad things arise. As I said, it also contributes to survival. But it's not necessarily the identical bacteria that we have in the intestine. Even if it's sometimes lactic acid bacteria. Now we come to the point. There are certain molecules where it plays a role. Whether they are naturally created, they are usually dextrorotatory. If they are artificially created, then there are enzymatic mixtures of partly dextrorotatory and partly levorotatory things. With bacteria, in the fermented I also have partly left-rotating lactic acid. Levorotatory lactic acid is actually what we don't want, even if the dextrorotatory lactic acid is the one we want. I can't measure at home how much levorotatory lactic acid I have in the fermented stuff.
That's actually a totally polarizing topic. I also have guests who swear on fermentation and fermented things. Now I'm just remembering all those blue zones, where they looked at why people live there longer. There was also a voice that said, what they all had in common was fermented food over the winter.
Exactly. I also looked into the blue zones. I think one of the biggest points was that people get so old because of nutrition. But if you look at where the blue zones are located in the south.
südlich. Die
Almost
fast
all
alle
of
auf
them
der
are on the
gleichen
same
Breite.
latitude,
Die
so they
haben
have
also
much
viel
longer warmth.
weniger warm.
Sonne, ja.
Das
That
heißt, der
means winter
ist
is
da
much
viel
shorter there.
kürzer. Wenn wir das
If we
schon
do
ein
that a
ganzes
bit
Stück
further in the
weiter im Norden
north,
machen,
we
dann
have
haben wir
much
viel
more
mehr
winter,
Wir würden also
so we
viel
would
mehr
eat much more fermented
fermentiertes
food.
Und jemand, der
And someone
absolut
who
nicht
lives
Winter,
all the
noch
way
viel
north lives
mehr.
even more.
Ja.
You could also argue that they ate the least fermented food.
If you argue that now, because of the winter, people still have in common that they ate a lot of carbohydrates and little animal protein. Extremely little, if consciously, no large amounts at once, i.e. no animal fats or little animal fats.
No grain, probably.
Little grain and what they processed. Let's be honest, a blue zone is in Sardinia, in Italy, they eat pasta.
There, now.
The 100-year-olds, 100 years ago also, or 50 years ago, or 30 years ago. But the wheat came from the field next door. They processed it themselves. It's not processed food. It's not spaghetti from the supermarket, from somewhere with glyphosate in it. There are different aspects. They don't have gluttony. That has also turned out.
But you still notice that today.
Although I also have to say, maybe they just don't have a disturbed hunger or satiety. Many additives make a disturbed perception. I always thought I was disturbed because I always eat full. Because many say, I have to stop before. Then I tried that too. No, that doesn't work. Then I'm hungry again, after 1 to 2 hours. Then I talk to overweight people and they say, does that work? No, then I'm hungry again, after 1 to 2 hours. Okay, you can eat full. Thank God. But it depends on what. That's not a question at all. And so there are certainly a few other components. Why? As I said, I have also dealt with it. And I give the credit to the fermented food. They just have other carbohydrates than we do here. What else is added as a cofactor? They have other social and family connections. That is also one of the important factors there. They have more sun radiation. They have more vitamin D. They have a different selection of fruits and vegetables. And over a longer period of the year, they are fresher than we are here. And I think this I grow something in my own garden and prepare it myself, that has been underestimated and forgotten. Hughland already knew that. There are studies that show that growing and cooking yourself has a very significant impact. And that is of course something else. If I ferment a small part of it myself, of what I may have grown, then it is something else than if I now buy a sauerkraut from the supermarket. Even if many people now ferment at home themselves. But the dose makes the poison. They have so much going for them that you can do that. I doubt that was the decisive point.
Finally, to you, does it make sense to take prebiotics, probiotics, intestinal repair, build-up?
Prebiotic products. These are actually bacteria-feeding products. This is primarily our diet. And of course it is important how I put them together. No question. I occasionally use prebiotics, especially if someone has extreme diarrhea or constipation. This can be used to regulate very well. Someone who had an antibiotic, I also use probiotics. But I would say that with 80% of my patients, after 4 weeks, I have such a great success with gastrointestinal disorders that I have already brought to the table.
Super. Nice.
With probiotics, I can achieve a change of the environment. You just shouldn't think that the bacteria I put in settle down at the bottom. It's not like that. I really have to make sure that the right ones grow back, and I take care of them. A probiotic can temporarily support the process.
den Prozess unterstützen kann und so weiter.
But if I
Und wenn
don't
ich nicht
work
an
on
der
the cause
Ursache
and only give
arbeite, nur
probiotic,
ein Probiotik
it may be that
gebe,
someone
dann
is
ist es
fine
so,
for a
wenn es
while,
gut geht,
even
eine
as many
ganze
months
Weile,
as he takes
auch
it,
so viele Monate,
and then he
ja,
puts it off
dann
again.
setzt er das wieder ab
And
dann
then
geht's
it
wieder von
starts all
vorne
over again.
los. Ja, das habe ich, sage ich mal, vor
Years
Jahren,
ago,
als
when
ich
I
dann mit
started
dem
with the probiotic stuff, I just made the experience.
Probiotika-Kram anfing, einfach die Erfahrung
It's
gemacht,
very
das auch
important
auf
to
der
apply it to the
Basis
cause.
an der Ursache anzusetzen.
Yes, nice.
Und
And
eben auch
also to make experiences
Erfahrungen zu
as a
machen
doctor
als
with the
Arzt, mit den
patient.
Patienten wirklich.
And
Und
that's
das
the
ist ja das
great thing
Schöne bei
about your
euch in der
clinic,
Klinik,
that you really
dass
get
ihr
out of the
wirklich
practice
aus
and
der
accompany the
Praxis
patient in a
kommt,
holistic
ja,
way.
und den Patienten ganzheitlich begleitet.
Nice.
Schön, super.
Super. Is
Gibt's
there
noch
any information for when a
Informationen
viewer
wenn jetzt
says
ein
they want a
Zuschauer
little
sagt,
care
ich
or
möchte da
holistic
doch
care?
ein bisschen Betreuung oder ganzheitlich?
Of course,
Natürlich
we
machen wir
like to
das
do that
gerne,
when the
wenn der
patient wants
Patient
to
zu
come
uns
to
kommen
us.
möchte. Wir sitzen ja im
We are
schönen
located in the
Schwelbrunn im
beautiful
BioMed Center
Schwelbrunn in the Sonnenberg
Sonnenberg.
Biomedical
Und
Center.
wir haben natürlich
And of
jetzt neben
course,
dem, was
in
ich jetzt
addition to
gesagt
what
habe,
I
was
just
auch sehr
said,
speziell für
which is very
Ärztebesuchen
specifically aimed at
ausgerichtet
my
ist,
medical practice,
noch
we have
weitere
other therapy options.
Therapiemöglichkeiten, ja, dass man auch
For
zum
example,
Beispiel
we have a strange
Akupunkturtherapie,
device
mit
called
dem man
Papami,
Therapie,
which you can use, or
was man
also local
benutzen
heat
kann,
treatments,
oder auch
which
mal
are also very beneficial for
lokale
abdominal pain.
Wärmebehandlungen, die bei Bauchbeschwerden auch sehr wohltuend sind.
But
Ja, und
ultimately,
letztendlich
it
gibt
goes
es
so
da so
far.
ein weites Spektrum. Wir haben
We
uns
have
jetzt mehr
now
auf den Darm
focused on the
konzentriert,
intestine,
dass man
that you
auch
can
mal
also
vielleicht
look for
Blockaden wie
blockages in the
Iliosakralgelenk
iliosacral
in der
joint, in the
Wirbelsäule
spinal
gucken kann, dass wir
column,
uns mit
which is taken
berücksichtigen.
into account.
Super.
Thank you very
Vielen Dank,
much,
liebe
dear
Alexandra,
Alexandra,
dass du da
that you
warst.
were
Ich freue
there.
mich immer,
I'm
wenn du
always
kommst
happy
und
when you come and
bald
hopefully
wieder.
soon again.
Dankeschön. Ja,
Thank
alles
you.
Gute.
All the best.
Ja, für Sie, liebe
For
Zuschauer,
you,
wünsche ich auf
dear
jeden Fall
viewers,
auch
I
eine
definitely wish you a
gesunde
healthy intestinal
Darmtätigkeit
activity and
und
hope you
hoffe,
were
Sie
able to
konnten
take a lot
einiges
from it.
mitnehmen. Vielen Dank fürs
Thank you very
Zuschauen. Bis
much for
bald und
watching.
tschüss.
See you soon and bye.